Hello everyone, Nikita here. So today's topic will be the tinnitus. What is tinnitus? Tinnitus is the noises which are heard inside the ear. There are two types of tinnitus. First will be the subjective tinnitus and second will be the objective tinnitus. Subjective tinnitus is a type of tinnitus which are heard by the patient. Roaring, whistling or ringing or buzzing sound inside the ear which are heard by the patient himself. Without such existence of such type of sound, that is known as subjective tinnitus. And second will be the objective tinnitus. So what is that? Objective tinnitus is a type of tinnitus which are this type of tinnitus is heard by the patient as well as the examiner. Means doctor can heard this type of tinnitus, that we will call it as a objective tinnitus. So these are the two types of tinnitus. Then we will see what are the causes which are responsible for this type of tinnitus. So the causes which are responsible for the tinnitus are like there is an infection in the ear. Local causes like infection in the ear, like otitis externa, otitis media. Then diseases like Meniere's syndrome and all. So then like general causes including leaking of temporomandibular joint. So then there will be aneurysm, arteriosclerosis suffering patient, patient with defective diseases of the related to the heart. Impaired blood circulation, in that patient we can also see. Then hypertension, anemia, then live insect in the ear. Emotional factor like chronic stress or emotional factors that lead to anxiety and depression also. Then next live insect in the ear, clonic contraction of the tympanic muscles. So these are the some causes which are responsible for this type of tinnitus. So we will see what are the characteristics of tinnitus. So tinnitus, the type of tinnitus means subjective and objective, but characteristics are intermittent, fluctuant, varies in intensity, high or low. Or continuous type of tinnitus means sound will be heard continuous. So this is a tinnitus. There is a ringing, buzzing, humming type of, whispering type of, whistling type of sound which are heard by the patient inside the ear. So this will be very irritable. So then we will see what should be our investigation in that case, patient suffering from the tinnitus, and what should be our treatment. Then exposure to a loud sound could be the cause of this tinnitus. So we will see what is investigation. So investigation in case of the tinnitus, first we will do hemogram for detecting the anemia. Then MRI angiography may be advised. Then third there will be VDRL test, vestibular test. Then vestibular test for the checking the function of the cochlea. Then VDRL test, vestibular test, audiometry test. In audiometry test, two tests like voice test and watch test. These are the two tests which are involved in audiometry. These are the functional tests that we have to done in patient of the tinnitus to detect the cause. And treatment. So treatment should be a causative treatment. Root cause should be known. And there should be a reassurance to the patient that it is not dangerous. Then there should be a surgical treatment like resection of the cochlear nerve. So then the treatment in the allopathy like antidepressant. They will give some medicines, but that will only temporary relief. That will give only temporary relief, not the permanent. So there is, up till now there is no curative treatment for this tinnitus, but there is some treatment in homeopathy that will help to cure it. To get rid of these symptoms of the tinnitus. It is a effective treatment. Homeopathy is a effective treatment. There is a individual remedy for the individual patient, at least as it works on the individualization. Means if there is a roaring sound in the ear, then we will give lycopodium. Lycasis. Then if there is a ringing sound in the ear, then we will give this type of lycopodium and all. So these medicines are different. Both patients are suffering from different sounds. So there is a different medicine for the different patient, means individual remedy for the individual patient. So we should apply we should take the homeopathic treatment for to get rid of this tinnitus. Okay, there are some medicines on homeopathy which works very well. Okay, and root cause is treated by this. Okay, so the surest way to cure this is the homeopathy. So come to the point, homeopathic management. First medicine like China officinalis. This medicine is the topmost medicine among the medicines of the tinnitus that will work well in the tinnitus. Okay, so the patient will be the weak, and there is a complaint of patient that is a humming sound inside the ear. Okay, the next medicine like causticum. Causticum is also good medicine in homeopathy which work well in the tinnitus. There will be in that patient there will be re-echo sound, means one sound is heard doubling. Okay, doubly there will be a sound, means if we talk one time, then it will be heard two times. So this type of sound inside the ear, re-echo sound, then we will give causticum. Then third medicine like there will be bryonia, chirping sound inside the ear. Then lycopodium for the roaring sound inside the ear. Then silesia, in that patient also there will be a buzzing sound that will be heard inside the ear. So in that patient it was very well. So China, causticum, silesia, bryonia alba, then lycopodium, then lachesis. Lachesis for the drumming sound inside the ear, that will work very well in that patient. So these are the some homeopathic remedies which work very well in the tinnitus. It is the safest way to cure the tinnitus and to get rid of its symptom. So consult today homeopathy if you are suffering from the tinnitus. Okay, so if you like this video, please like, share and subscribe my channel. Thank you.